I want to tell you a little bit about a day in the life of a plastic surgeon. I really feel very blessed because I love my job. I love the career I have. It took a lot to get here, but I love it. And over the last 7 years of me being in practice, it has shifted and changed into what my day-to-day looks like. I would say really only in the last 3 years have I finally hit a place where it's steady in terms of what the day looks like. For the first 4 years of my practice, I was taking call at 8 different hospitals around the valley, a lot of hand trauma, a lot of facial trauma. And so my days were all over the place. I could have a night where I was stuck at the emergency room and then in the operating room fixing a gnarly hand gunshot injury and then coming straight back here and continue to operate on my cosmetic cases. And that was not uncommon at all. But it was also, for me, got to the point that it was unsustainable. And so I don't take call anymore. I'm grateful for the years that I did take call and for all of the experience and knowledge and training that gave me. But now what my practice looks like is the things that I love, the things that I'm really good at and consider myself an expert in. And I break my days up into kind of 2 categories. I have OR days where I'm operating, and I have clinic days. Sometimes we combine those things, but that's pretty much the general breakdown. If I'm in a clinic, that means I am here in the office seeing patients. Those patients are a mix of new consultations, so people looking to have surgery and they want to meet with me and talk about their options and come up with a plan and get a quote for surgery. Established patients who've been operated on and we're checking to see their progress, how they're healing, what's going on. Sometimes it's procedures, like little small procedures that we would do under a local anesthetic, like a mole removal to a scar revision, anything in that vein. And we do that here in the clinic. I've got a staff of nurses and front desk and patient coordinators that make that whole system run, and an office manager who are phenomenal. When I'm in an OR day, I'm operating, and it depends on where I'm operating. I do operate at a few different sites. The main site that I operate is at my surgical center, which is Canyon Crest Surgery Center. I also operate at Lone Peak Hospital, St. Mark's Hospital, and Riverton Hospital. I'm at the hospital if I'm doing an insurance case. I'm here at my surgery center if it's an out-of-pocket or a cash pay case. On operating days, I usually start early in the morning, get here around 6:30, 7 o'clock, and we're usually in the operating room and going around 7:30. Those days can go usually until about 5 o'clock. I like to be done operating by 3 because I like my afternoons and I like to get home to my kids if I can. Sometimes they go long if we need to, if a case is going longer than usual. And the number of cases varies dramatically. Some days I have one big, long 7 to 8 hour case and then a small one. Some days I have a lot of little small cases, like 4 or 5 breast augmentations in a day. Sometimes go with medium ones. It varies wildly. And that's one of the biggest reasons I went into plastic surgery is the variety. I could do 8 breast augmentations back to back, and each one would be so completely different from the last that it kind of maintains my interest and it keeps me excited and going. That's a day in the life of me as a plastic surgeon. For me, the most important thing is being able to get home to my wife and my kids. And so my schedule is arranged to accommodate that. If you know me at all, you know that I was divorced when I had about 2 years left of residency. So when I came back here to Utah and started practicing, I set up my practice in a way that would give me the most time with my kids. The way my schedule has always been set up is Thursdays, I end early, around 3 o'clock at the latest, so that I can get home and pick up the kids from school. Fridays, I try to start late so that I can get the kids to school. And then Mondays, I try not to operate on Mondays so that, again, when the kids are with me on the weekend, I can get them to school on those Mondays. It's all been arranged to be the best for me and my family. Another one of the reasons that I love it. I get to run several businesses, I get to see patients who I love, and I get to take care of my family. Those are the most important things in the world to me. So what do I like about being a plastic surgeon? It's hard to just say everything. Obviously, I do love this job. And the things that I love the most are being able to see patients' lives improve by undergoing a plastic surgery. I truly believe that plastic surgery has nothing to do with vanity. It can at times, but I think when it's done for the right reasons, in the right patient, it is more about self-empowerment than it is about vanity. The look on somebody's face when they can finally see on the outside how they feel on the inside is one of the best things in the world for me. A lot of my practice has been geared towards body contouring after massive weight loss, and those patients have gone through absolute hell and hard work and discipline to lose oftentimes 100+ pounds to get to where they are, only to realize they now have all this loose extra skin that has to be cut off. And it's such a treat for me to be able to come in and remove that skin and help them see all of the hard work and the discipline that they have done. For me, I really do the easy part. And it's one of my biggest joys in life to see those results come to fruition for those patients. What do I dislike about plastic surgery? There's not a lot that I dislike. However, the patients that are unhappy are the ones that always stick with you. If you have no unhappy patients, you're not operating enough. I can go through a clinic and have 40 patients in a clinic. 38 of them will be ecstatic, thrilled, happy with their results. One of them will be going through some scar issues or something else that we're dealing with. And then one will just be unhappy. And it's the unhappy ones that honestly keep me up at night and make me think about what could we have done better? What went wrong? How can we fix this? Usually when you have an unhappy patient, in my experience, it's because the expectations of what the surgery was going to be were not in line. I'm overly honest with all of my patients. I'm not the guy who will tell you, trust me, you're gonna love it, don't worry. I want you to know exactly what you're gonna get when you come out of that operating room. And so we go through a lot of conversations, a lot of time where we just set expectations. For example, liposuction to the lower extremities, the legs, I tell everybody, whatever your expectations are, bring it down 3 notches, because liposuction to the legs is really difficult to get a knockout home run. And you've got to be conservative, because the second you take too much fat from the legs, you get these weird ripples and divots and ice cream scoop looking legs. So again, it's all about expectations. And when I fail to appropriately set expectations and somebody's unhappy, that's the one part about plastic surgery that I don't like, or that at least doesn't sit well with me. All right, I want to talk about a little bit of a trend that I'm starting to see more and more of in plastic surgery, and it is getting rid of these. A lot of people are coming in and wanting their implants out, but they still want to maintain some volume. So what are their options? Fat grafting. Fat grafting is what we do to replace implants and give some volume. There are pros and cons between implants and fat grafting, and so we have to go through all of those with the patient to determine what the best option is for them. But more and more I'm seeing women opt for implants removed and replacing it with fat grafting, or even women who want an augmentation but don't want implants at all. And so we just start with fat grafting rather than remove any implants. The pros of implants are they're very predictable. We know exactly the CC volume that we're going to get, and you can also get good upper pole fullness with implants. It's a permanent implant. As long as you maintain a steady weight, you won't lose it, you won't gain it. It's not going to have revisions done. The downside to fat grafting is it's not as predictable as implants. Only about 80% of the fat that we graft survives. About 20% of people who have fat grafting done either need or want a second round of fat grafting. And then with fat grafting, the fat tends to settle, and so you get a more natural looking breast. And so when patients come to me and say, I really, really want upper pole fullness, that's really difficult to achieve with fat grafting. So a lot of times we have to go to an implant with them. But fat grafting is right now something I see a lot on the rise. Even if you are somebody who doesn't have a lot of body fat, we can oftentimes still get at least a half a cup to a full cup of augmentation based on fat alone. We may need to go to as many areas as we can, like the thighs and the arms, to get the fat, but it is an option for augmentation without implants. And that's one trend that I'm seeing more and more on the rise in the last year.